I would like to introduce needle-free injection system Comfort-In to you. I am currently running On's Advanced Dental Clinic and got postdoctoral training in the Department of Periodontic and Oral Medicine, University of Michigan. I would like to introduce the product Needle-Free Injection System Comfort-In and introduce the necessity, usage, and practical application cases of this product. I don't think syringe needle is an easy thing to accept for everyone, although the level of feeling would be different for each person. There are injections into blood vessels such as intravenous injection, intra-arterial injection, and intraosseous injection, and injections into tissues such as intradermal injection, subcutaneous injection, and intramuscular injection. The product I would like to introduce today is a needle-free injection system that can be used for intradermal, subcutaneous, and intramuscular injections. Based on the data of the American Psychiatric Association, about 10% of the population is diagnosed with a mental disorder due to a severe phobia of needles. The background of development of this product from the user's point of view is as follows: anxiety about being stabbed by a syringe needle and the risk of infection due to reuse of syringes with needle. The background of development of this product from the developer's point of view is as follows: the physical limitations that needs to be overcome to administer drugs in cases where highly viscous or high concentration drugs need to be injected, and the rapid increase in the use of biological drugs, for example, the enormous stress experienced by diabetic patients when they inject insulin into the abdomen with a syringe with needles every day. There is such a background of development of this product. Today, I will mainly talk about this product that is used in dentistry. Currently, this product is used not only in dentistry, but also in the case of diabetes patients when injecting insulin into themselves. In addition, it is used for intramuscular injection below the epidermis, subcutaneous injection, and intramuscular injection in various fields such as dermatology, plastic surgery, and urology. The principle of this product is that a drug can penetrate the skin and mucous membranes without a syringe needle using the principle of jet injection, with which a drug can be instantaneously sprayed with very strong pressure. Unlike in case using a syringe needle, a drug can be instantaneously injected and absorbed to the human body with strong pressure if using this product. So it has the advantage of being able to penetrate the skin and mucous membranes without pain. In particular, among the various products using principles of jet injection, one of the special advantages of this product is as follows. If using this product, a drug can be selectively injected according to the various dose of the drug ranging from 0.1 cc to 0.5 cc. Let's check the injection method using principles of jet injection, which is used in dentistry. Local anesthesia is required for most procedures performed in the dental clinic. Local anesthesia refers to the reversible blockade of nerve conduction to cause sensory loss in a local area. Let's assume that there is no pain at the time of the procedure by controlling the pain with such local anesthesia. Will the patient's anxiety and fear about dental treatment be disappeared if there is no such pain? It's not like that. Patients have vague anxiety about dental treatment and fear of syringe needle. Let's look at the various methods developed as an alternative to traditional syringe needle. As you can see, it is very effective to use a local anesthetic, that is, benzocaine, which is widely used in the clinic. Other than them, as you can see, there are products which I would like to introduce today, and there is also a method of iontophoresis. The methods mentioned here are the methods that do not require syringe needles. As you can see, there are several methods to reduce the pain and make the patients less uncomfortable while still using a syringe needle. The picture on the right side shows a way to reduce the drug injection rate to very low level using a computer. It is a method to reduce the pain induced by the injection of syringe needle by creating vibration around the syringe, and intraosseous injection is to increase the strength of anesthesia. For example, when nerve anesthesia in lower periodontium fails, intraosseous injection by making puncture into the bone cavity around the molar teeth and premolars to be treated directly can lead to anesthesia corresponding to the nerve block. These methods have in common that they are attempts to reduce the discomfort of the patient during injection of anesthetics. But unlike the needle-free syringe shown above, a syringe needle is still used in those methods. As mentioned before, even if the patient does not feel pain, there is vague anxiety and pain about the syringe needle. So, a needle-free syringe product has been developed like the product I will introduce today. The problems of the methods developed as alternatives to the traditional syringe with needle are as follows: very technique sensitive, high initial cost, possibility of allergy in case of topically applied anesthetic, and time consuming for slow injection using computer. So needle-free products have been developed, and I would like to introduce them today. I searched the history of when these methods were used in dentistry or medical field. It was already tried for herd immunity in 1866, and since then, it has been used steadily as an intramuscular injection or subcutaneous injection for the hepatitis B vaccine or insulin injection for diabetic patients. The picture on the left is a jet injector called SiriJet that was marketed in the US in the 1970s. The picture in the middle is a product called Injex that is still in the market, and the picture on the right is a product called Comfort In that I would like to introduce today. I would like to introduce an interesting experiment among the most recent original articles. The title is Needle-Free Mental Incisive Nerve Block, and it is about whether mental nerve block can be performed using a jet injector in dentistry, and that so the penetrating to the deep sites is important. In this paper, the authors prepared these experiments as shown in this diagram. There is a jet injector on the left and a traditional syringe with needle on the right. A force sensor was set up to measure values under various pressure conditions, and video was recorded while injecting the transparent gelatin. The paper shows data comparing the difference according to pressure. As you can see, the authors compared the depth by image recording a drug that passes through transparent gelatin. As shown in the photo above, it shows whether the drug has reached to the mental foramen with a syringe with needle-using dye.
멘탈 포라멘 근처까지 이제 염색약을 이용해서 그 약물이 도달을 했는지를 보여줍니다. 그 멘탈
It shows successful and unsuccessful cases of mental incisive nerve block.
도달하지 못한 경우 보여주고 있고요.
Also, when the successful and unsuccessful cases of mental incisive nerve block using a jet injector is compared to the syringe with needle, the success rate is slightly higher with the syringe with needle.
성공률은 니들 인젝션이 조금 더 높긴 해요. 근데 이 논문의 결론을 보면
However, this paper concludes that it was sufficiently possible to achieve mental incisive nerve block by reaching the drug near the mental foramen using a jet injector.
멘탈 너브 블럭이 충분히 가능했다라고 결론을 내리고 있고 그리고 추가적으로
And it also concluded that jet injectors should be used for local dental anesthesia with as little pressure as possible to avoid the potential for hematoma and nerve damage.
너브 데미지의 가능성이 있으니 가능한 약한 압력으로 제트 인젝터를 치과 국소 마취에 사용을 해야겠다라고 결론을 내리고 있습니다.
Now let's watch a video introducing a product called Comfort In.
The sounds of buzzing and that sterilized smell. Add to that a long and sharp needle. It all adds to that sense of fear while at the dentist. Healthcare professional Woo Hyun Kim owns a dental clinic in Seoul's Gwangjin-gu and had always felt the pain of his patients who were afraid of visiting him because of their uneasiness of needles. That was until recently when he began to use Comfort In. Faster anesthetics, much less pain. His patients are now much more at ease and don't need to be afraid of needles anymore. Comfort In is a hypodermic that can deliver medicine into the body without a needle. It works by microscopically spraying medicine instilling into the dermal layer via its 0.15 millimeter hole. The pressure at which it administers the medicine is 118 times the pressure found in car tires. It seeps 0.2 to 0.8 centimeters deep into the skin. The liquid medicine inside the Comfort In itself acts as the needle, and the whole process takes less than a third of a second. That's why there's virtually no pain and no marks left behind.
The Comfort In doesn't come with any prickly needles, so it's easy for anyone to use.
This is a picture of installing the nozzle before use. Comfort In can be used in various ways depending on the application in dentistry. The company is releasing products that are divided into 3 categories according to the pressure. For the use in dental clinics, as I said in the paper a while ago, I recommend the soft one with the weakest pressure. Even for the use in dental clinic, depending on the internal part of the oral cavity, it is sometimes easier to use a medium spring power injector, which I will introduce later in the lecture. So, in conclusion, medium and soft ones are recommended for dental clinic. The normal one, exhibiting the strongest pressure, is being used in other medical fields rather than dentistry. As previously mentioned, Comfort In can be used by adjusting the dose of the drug from 0.1 to 0.5 cc. It can be used more efficiently in dentistry when applied to local anesthetics, such as artecaafinoprine or bupivacaine, which have a stronger anesthetic effect or have a longer duration at the same dose. This shows how to activate the spring before use as if loading a bullet in a pistol. There is a way to charge spring like this manually with a hand. As you all know, the principle used in the product is the lever principle that can produce the strongest pressure. By applying the lever principle, everyone can easily activate the spring inside the product and prepare it.
해서 준비를 할 수 있고
And
이때는
at
이제
this time,
안전하게
you can lock it safely so that it is not used
납땜을 걸어놓을 수
accidentally.
있습니다.
I'll show you a video in a moment.
동영상을 보여드리겠습니다.
As you can see here, there is a white hanging part.
손잡이 부분, 이 윗부분을
Make sure that this part of the handle matches to the hanging part here, and then insert it in this state. Then place this metal post.
쇠 부분을
메탈 포스트 부분을
Locate the metal post in the proper position and press it manually until it clicks.
모양으로
딸깍 소리가 납니다.
Just press it until you hear a click.
누르면 돼요.
Well, even the female staff at our dental clinic did it easily.
또 다른 방법은
Another method is to put it in a box like this and press it. But based on our experiences at our dental clinic, it was more convenient to do it manually.
방법이 더 편리한 것 같습니다.
똑같이 가압하는 방법.
Let's see how to do it using a pressure box.
장치이며 이거는 그냥 이렇게 뚜껑을 열고 탁자 위에 올려두고 요 손잡이 부분이 위로 올라오게끔 하여서 요 헤드 부분이 요 똑같이
Locating the product inside the box is performed by applying the same principle. Instead of pressing manually, you should press the box lid by applying pressure.
누르는데
손잡이 부분을 위쪽으로 올라오게 해서 이렇게 넣어줍니다. 그리고 요 헤드 부분
As the same lever principles applied, a strong force can be easily applied.
하고 그다음 그냥 끝 부분을 한번 올려주면 가압이 끝나게 되는 것입니다.
노즐을 처음에 그
Please take out the nozzle in sterilized plastic package at first and push the piston up and pull back the piston once and put it back to its original position before using it.
사용하면 그 노즐에 있는
This makes it easier to inject the drug without the cases moving less due to friction between the rubber part of the nozzle and the inner wall.
없이 용이하게 약물을 주입할 수 있습니다.
Let's see the video about injecting the drug for a second.
진공 상태로 공간이 띄어져 있습니다.
If you look at it, there is a space in semi-vacuum state. You should remove this gap always by turning this bar and then by lifting it up and then by lowering it again.
한쪽에 발려져 있는
Then the bright medical-grade silicone inside makes this piston bar move smoothly.
여러
The drug is then pulled out using several adapters.
약물을 빼내게 됩니다.
치과 의사라면 누구나 익숙해져
The company
있는
provides a dedicated adapter that can be attached to a metal syringe for local anesthetics, which is familiar to all dentists.
전용 어댑터가 회사에서 제공을 하고 있습니다. 당연히 일회용이고요.
Of course, it is disposable, and there is a needle inside the silicone adapter that can be inserted into the lidocaine ampule.
앰플에 꽂을 수 있는 니들이 있습니다. 그 반대 방향에
You can install the nozzle in the opposite side by rotating it to withdraw medication.
약물을 주입하면 되는데요.
If you remove the nozzle plunger from the nozzle while gently pressing the syringe part, the drug can move easily into the nozzle, so you can load the drug into the nozzle as much as you want. Let's watch a video briefly showing the process of withdrawing drugs to the nozzle using a dental adapter.
동영상을 잠시 보겠습니다.
Okay, Jess, so now you're loading lignocaine. So you're using the standard syringe that you have in your clinic?
Yeah, so you just have your normal LA and you just take it out the needle like that.
앰플이 들어가
Please insert the adapter into the syringe with anesthetics containing ampule.
Really easy and really comfortable and simple to use. So you just twist until it gets just like tight.
다양한 사이즈의
The company offers disposable adapters that fit syringes in various sizes.
일회용 어댑터를 제공하고 있습니다.
Just twist it in here.
After fixing the nozzle by twisting it slightly, the one is loading the desired amount of drug to the nozzle and from the lidocaine ampule to the nozzle.
노즐 안에 들어간 약물
You can adjust the pressure to the amount of drug that is loaded into the nozzle. Unlike other products, various volume capacities are available in the Comfort In.
사용할 수 있는 이유가
There is a scale on the Comfort In body like this, and by turning it clockwise like a screw, for example, if 0.2 milliliters of drug is loaded into the nozzle, please turn the handle of Comfort In clockwise by the increments corresponding to the scale on the Comfort In body.
그 칸에 맞는 눈곱만큼 컴포트인의 손잡이
If you
부분을
set it to the scale on the Comfort In body, it will be set to a pressure suitable for volume capacity.
그 용량에 적합한 압력으로 세팅이 됩니다. 그래서 연결한 다음에는
After connecting is completed in this way, it is optimal to make very tiny drops at the tip of the nozzle.
맺힐 정도로 하는
That
게
means there should be no air in the nozzle.
노즐 안에 공기가 있어서는 안 된다는 거죠. 여기까지 확인을 하고
Let's watch the video for a moment to show how to check and inject it.
하는데 동영상 잠시 보겠습니다.
그 노즐의 0.2 부분을 맞춰서 동일하게 맞춰서
If you set the same value of 0.2 in the nozzle, you can inject a drug under the most optimal conditions.
경우는 사실 노즐과 요그 인젝터의 숫자를 딱 맞추시는 게 좋습니다. 그래서
For dental use on the gum area, it is recommended to match the values of nozzle and this injector.
인젝터의 헤드 부분을 올려서
I pulled out the drug that corresponds to 0.3 and rotate the head of the injector like this and set it to 0.3.
연결을 하고요. 연결을 하고 치과
And when turning it, always hold the head of it together to avoid its turning.
꽂고 난 다음에 헤드 부분을 돌리면
Please connect like this for the use in dental clinics or pediatrics clinic. Turn the head until the drop of the drug is shown above slightly after inserting like this. This will allow you to inject a drug under the most optimal condition.
쏘주겠습니다. 0.2cc를 맞아야
노즐 캡은
There are two types of nozzle caps. There is a flat nozzle cap that is flat in cross-section according to the anatomical shape of the oral cavity, and a curved nozzle cap can be used for areas like a curved surface, such as the palate.
커브드 노즐 캡을 사용하면 되겠습니다. 사용 직전에는 락을 보시는 사진에
As shown in the picture, just before use, please unlock the lock function, a safety device, counterclockwise to release it, and then press the blue part to inject a drug.
그리고 누르면 파란 부분을 누르면 인젝션이 되겠습니다.
The drug delivery will be more effective if you stay for about 3 seconds right after injections.
동영상 다시 보면
Let's watch the video for a moment. The person is unlocking it now and press to use it.
눌러서 사용을 하고 구강 내에서는
And please use a silicone cap if used inside the mouth. It is recommended to use a cap at the end of the injector nozzle to avoid breaking the sealing at the area where the nozzle contacts to mucous membrane, and then release it after holding it for about 3 seconds.
동작으로 있다가 떼는 게 바람직하겠습니다.
When applying to the maxillary palate, it is recommended to use medium one, applying a slight stronger pressure. And it is recommended to inject about 0.1 milliliter and to use a curved cap with bevel so that the cap fits the shape of the targeted area. One of the most painful areas when a patient underwent local anesthesia in a dental clinic is the maxillary palate. I think that it is an area where local anesthesia can be efficiently performed in a very short time without pain if using Comfort In. If you are preparing for nerve treatment or dental prosthetic treatment of 2 maxillary central incisors, the incisive foramina will be the area where you can perform anesthesia very efficiently with Comfort In. As strong pressure is required to anesthetize this area, it is recommended to use a medium one. Similarly, the curved nozzle cap with bevel is recommended to be connected because of the curved anatomical shape. If you look at the arrow in the picture, you can see that it is pressed like this with a finger. You should press it down by applying pressure manually so that the sealing is not broken down and the drug is released. Pressing and holding for 3 seconds after injection is also very important to ensure that the liquid is injected in sufficient volume.
팔레이트
It is a photo showing the scene of painless infiltration anesthesia using the needle-free syringe Comfort In.
사진이고요.
In the lower jaw, mental incisive nerve block can be performed. For this, 0.3 cc of lidocaine is applied using medium one rather than soft one. As everyone knows, the targeted region is the root tip of the second premolars in the lower jaw, or mental foramen, located slightly anterior part. As shown by the experiment using cadaver in the paper I showed you a moment ago, it is essential for drug to reach to the mental foramen for the success of mental incisive nerve blocks. And the things you should keep in mind for this is the same as mentioned before. You should apply pressure with your fingertips to prevent the sealing from breaking, and hold it for about 3 seconds after injection. In this way, mental incisive nerve blocks also can be used. Let's watch the video for a moment.
This is like a cut.
비닐 캡 씌울 거.
Okay. After we put sleeve, the rules everywhere. This not go for sterilization. Okay. So, but always make sure drop come out. Okay.
약물을 끝에 살짝 맺혀야 노즐 압력이 본체하고 똑같은 거거든요.
We follow what they teach dentists in dental school. Same angle like you do with syringe. Never in, okay, now if you go here into gingiva, apex is bone. Bone density very high. It's like making injection on water. No absorption. Nerve is much deeper. Nerve is higher. Just like when you put 45 degrees. So for this one, we go like this. Never like this.
이빨이 너무 딱딱하니까 그 안목은 안 들어가잖아요. 만약에 45도로 하면 네이버를 잘 들어가고 영향을 잘 될 수 있어요.
If you use
Most of all, making the drug to be reached to the mental foramen is a key. Based on the CT scan, the distance from the second premolars to this mental foramen is about 14 to 15 millimeters.
limited only.
What this person is explaining now is that Comfort In should be face down towards the mucosa at a 45-degree angle. In particular, in the case of using the medium one, if you apply pressure directly on the alveolar bone, the patient may feel the pressure and feel very uncomfortable and be startled.
Standard full syringe. Full. Easy. Because if you take this 0.5 and put in syringe, is only one injection. You already give 0.5 with one squeeze, because your carpule is 2.3, 1.8. How much you have in there? How much?
소란지 사용할 때 압력이 어때요?
2.3.
너무 세지.
Okay. Watch. What? What do you want?
Depends on the situation.
Okay.
For dental practices, medium one up to 0.5 cc is acceptable, and for soft one, up to 0.4 cc is the appropriate pressure. If you do mental foramen block, it is possible to use 0.5 cc using medium one. It shows upper jaw now.
Okay. Free? Okay. And go, you see everywhere.
특히나 성악은
In particular, the upper jaw should be directed toward the root tip.
치조고를
Therefore, instead of turning it at 90 degrees toward the alveolar bone as shown in the video now, we should target towards the root tip of premolars at 45 degrees.
You can do
겨냥을 해야겠습니다.
imperial block. Palette, okay? Is like this and support
지금처럼
but different adapter. But here now we just go like this, straight.
지금처럼
Okay.
상하
And you see
As it is
going
shown now,
parallel.
the anterior part of the upper and lower jaws can be placed perpendicular to the alveolar bone.
No, you sit down.
근데 이미 마취됐다고 하네요.
Ask Mr. Joe which.
But my CEO tell if you do the same place that you did just now, it could hurt. Is it fine?
반대편에.
You already know. Injection.
Well, then you won't feel it.
Please go 25 sulcus.
방금
Where you
하신
put
거 25.
syringe, where you normally put syringe. Right? Tell them to apply pressure, sufficient pressure to create a seal around there. Sulcus.
Is it hurt?
No.
Does it? He's gonna do it. 1, 2, 3. Did it hurt?
Yeah.
안 아팠어.
And I don't taste. Tell them no taste of the anesthesia.
인젝션 사용하니까
You're very good. Yeah. Does he lose time? Can he lose time, waste time, when patient is scared from, so you can lose time from, okay. The argument in Australia is dentist is dentist, not psychologist. And talk to patient, relax, calm down, is tick, 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 and time is money. So when you take this soft, normal, medium, doesn't matter. You sit the patient here, you give injection, and that.
예, 조금
You
전에
saw a video of trying to perform mental incisive nerve blocks a while ago.
보셨고요.
The area where infiltration anesthesia can be performed easily is just below the upper and lower jaw and labial alveolar of anterior 6 teeth.
식경부 바로 아래쪽인데요. 여기에는
It is good enough to use soft one, and the volume capacity less than 0.4 or 0.3 milliliters is acceptable.
되고요.
In particular, it is regarded as a site where infiltration anesthesia can be performed very easily in pediatric patients as it is rapidly absorbed in them. It is anterior part of upper and lower jaw.
동영상
So, I will show you the procedure of it as the last video briefly.
소리만 요란하게 나니까 놀라지 마시고요. 마취 먼저 할게요.
딱 소리 납니다. 놀라지 마세요.
세신 소리 나요. 하나, 둘, 셋. 네. 지금 어떠셨어요? 이 정도 괜찮으시죠? 이거 한 번만 더 할게요. 이거 한 번 하면 더 이제 마취 끝내는데.
딱 소리 나요.
In some cases, the patients are startled with a sudden sound, although they could not feel any pain. It will be very helpful to make the patient more comfortable to give a warning in advance that there might be a sound when injecting. This is all for today to introduce Comfort-In to you. If you have any questions about this product, please contact the website, email, or phone number shown on the screen here for more information. Thank you for listening.